Like, I'm very interested because I know you're a nutritionist as well, right? You graduated from McGill as an undergraduate. You graduated from McGill with a nutrition degree, but more mainly focused on geriatrics, the elderly people.
And renal and
the renal, so kidney and kidney health,
like IBD, so like Crohn's disease, like internal medicine.
That's interesting, very interesting. And then you went ahead to go into Harvard, and you did a master's degree in what?
So it's public health and nutrition.
That's amazing. Okay.
Yeah. So it's basically how do we make people healthier or eat better on a population level instead of an individual level. And so that's what part of my startup is doing. So like, how can we increase access to high quality nutrition care? And that's by, one, working with insurance and employers to get it reimbursed and make the out of pocket cost as low as possible. And then second is to make it super easy to use. So through telehealth and telemedicine, it's super easy to get access at the comfort of your home and anytime you want, in the evenings or weekends. Super easy to access a board certified dietitian.
Okay, got it. Just to give you guys a sense of what Ali is trying to do. So she is in the incubator program with Harvard, and they're trying to have a startup company. They're very successful already. They already recruited 50 top nutritionists to work with them. And their focus is more on pre-diabetic patients as well as patients who have PCOS, right?
And also just general, because we have such a big network of top dietitians, we can help with sports nutrition, right, or like weight loss, weight management. Also people who are on GLP-1s like Ozempic, we also help with supporting that process to make sure that they're managing their cravings and that the medication is as effective as possible by supporting them with lifestyle habits and changes. But a lot of our patients come also for IBS.
Which is a very important, I think, for a lot of people, especially for guys, right? When you talk to the young kids, okay, where's your father all the time? It's always in the washroom. Yeah. My father is always in the washroom. I think a lot of the guys are are bothered or like are burdened by this issue of IBS, which is you go to the washroom constantly. Whenever you eat, you feel discomfort. You are already dairy free. You're not eating dairy not because of lactose intolerance, but you are always constantly going to the washroom, and it seems like you spend a lot of time there. And then always like before going to the washroom, you have this like a discomfort in the belly as well. Because as Western medicine, we can't find a reason, a cause. We just call it IBS, which is irritable bowel syndrome. Because we don't know the reason. You don't have blood in your like a stool. You don't have any like triggering diet. You just, whenever you eat, you just have this discomfort. My husband is plagued by this as well. So I do like concur with you that this is a huge population actually. If you guys can help this population, and this is going to do the society a lot of benefit as well.